Todd Hawes back on Alabama Tonight. We continue our medical theme here this evening. Former Auburn quarterback Cam Newton back in Auburn this week. Just had surgery. We're going to talk about that in a moment. Dr. Norman Waldrop, for those here from Dr. James Andrews' firm. And first I want to ask you, because you did the surgery today on Shannon Hale, the Alabama basketball player who we found out had a broken foot. Anthony Grant told us about that in his news conference today. I know you have the whole patient-client privilege you can't talk about, but the type of surgery that he might have had today, what's the prognosis for a full recovery?
Actually, it's very good. Obviously, can't talk about specifics of that surgery itself, but typically it's an injury that we see in athletes. It's very common in football and basketball players, and typically these have a full recovery. It takes a good 6-10 weeks to get these players back, but fully expect him to be back on the court this summer and ready to go, because the team is certainly going to need him.
Yeah, not that it ever happens at a good time, but if it had to happen, it happened at a good time for him, no doubt.
Right.
All right, let's talk a little bit about what Cam Newton's dealing with. That's why you got the foot in your hand here. He's going around campus at Auburn on a scooter to try and help that out a little bit. Stretched ligaments is what the problem was. He kind of hurt it near the end of the season, the playoff game against the 49ers. I remember that. Rest did not cure the problem, so he decided to go ahead and follow the doctor's advice and have surgery. Tightening of the ligaments, how much of an involved surgery is that? What's the rehab like for something like that?
So typically this is an injury that has been building over time, and this is something that didn't just happen to Cam. It probably happened 5, 6, 10 years ago, and is an injury that will progress over time. It's something, ankle sprains are things that are ubiquitous in athletes, and they happen all the time. And
hang on, you're on a sports show. Don't use big words.
They happen.
Slow down.
Excuse me by that. Sorry. They happen all the time. And in Cam's case, unfortunately, he rehab did well, but after 4 years of constant pounding and the high-level athlete that he is, the rehab was no longer doing him any good, and he was having trouble with his ankle. So it's actually probably the surgery that I do most commonly, and I fully expect Cam to get back to full speed and have no trouble with it.
A few years ago, I had 3 ankle surgeries, so I kind of know what you're talking about here. And so the question is, what is the long-term prognosis? I can tell you when it's going to rain before it rains. How about him? He's a running quarterback. He depends on his feet to get around and score touchdowns. How does this affect his career?
Yeah, that's true. They did the surgery, so it doesn't affect him long term. He stretched the ligaments that are on the outside of the ankle, and typically when we turn the ankle in this sort of manner, these ligaments get worn out, and over time they quit working. And the reason to do the surgery is to tighten them so he doesn't keep spraining his ankle, so his career can be long. Okay. In the short term, he has to back off a little bit, but for the long term, he'll be better off.
Last question, we got about 45 seconds. Parents out there are kids who almost play year-round sports now, very little break in between sports. What do you tell them about trying to prevent any kind of injuries?
Well, typically, I think this new phenomenon of playing kids year-round is typically a bad idea. Rest is very important, especially in these young kids. We try to get them to back off activities, take a 2-month rest, a 1-month rest in between sports, because we're seeing kids younger and younger have these type of injuries, which typically in athletes don't pop up until their late 20s, 30s, early 40s. And unfortunately, we're seeing more and more of that. And I think, and I know Dr. Andrews feels the same way, that rest is extremely important in prolonging athletes' careers, whether that's a professional athlete or the weekend warrior.
All right, I like talking medicine. We'll have to have you back on. I appreciate it.
Absolutely.
All right, Norman Waldrop in here. All right, stay ahead.